This is Where We Live on Connecticut Public Radio. I'm Lucy Nalpathanchel, broadcasting remotely. It's more than 11 months into the pandemic, and the state has begun its second phase of vaccinating residents beyond healthcare workers, first responders, and nursing home residents. Today, Where We Live, we talked to Connecticut Governor Ned Lamont about how it's going in a week that saw vaccine appointments canceled and doses delayed. Besides running the state during a pandemic, next week the governor will release his proposal for the next 2-year state budget, with the projected deficit to be $2.5 billion over those 2 years combined. Later, we'll hear from Mark Pazniokas, Capitol Bureau Chief for the Connecticut Mirror. First, what questions do you have for Governor Lamont? Join the conversation. 888-720-9677. That's 888-720-WMPR. You can find us on Facebook and Twitter at Where We Live. Now, this is Connecticut Public Radio's winter membership drive this week. We're not doing pledge breaks this hour, but you can always go to WMPR.org to support. Now, Governor Lamont, welcome back to the show.
Morning, Lucy.
So let's just dig right in, because I know you're going to be heading out to a vaccination clinic in the city of Waterbury. Vaccinations on the minds of many state residents. Earlier, we heard that UConn Health and Waterbury Hospital had to postpone vaccine appointments this week. Originally, UConn Health saying their allocation was less than previously expected. And just the other day, almost 1,000 doses were brought to UConn Health by the National Guard, and they were able to reschedule patients who'd had their appointments canceled. You said in an interview with CBS Face the Nation that one or two of these systems may be overpromised, and you're watching that situation carefully. So now that they've gotten their doses, at least one of the health systems, would you say this is a one-off, Governor Lamont, or does this raise concerns about the pipeline for vaccines in our state?
A couple of things, Lucy. Let's pull the lens back for a second. Just to remember that Connecticut is one of the very best states in the country when it comes to getting people vaccinated. Higher percentage of our vaccines actually end up as a shot in the arm. We have over 10% of our people who have been vaccinated. But you're right. We were getting from the feds, a week notice. And then the hospitals, for example, would ask for an allocation on Tuesday. We tell them what that allocation is going to be on Thursday. The allocation would arrive for them on Monday or Tuesday. So I'd say in 95% of the cases, it's worked pretty well. In a couple of cases, one or the other have gotten a bit ahead of themselves. But I think it's going to get more complicated, by the way, Lucy. We're going to get a lot more vaccines, and the next group of people able to be vaccinated opens up. But I think we're ready.
When you talk about it's going to get more complicated, so what is the state doing to make sure that doses are reserved for the people at most risk? So right now, residents over 75 years or older can get the vaccine, but there have been reports of people that don't fit this criteria getting vaccinated, including school board members and spouses in Region 14. That's according to the Hartford Courant. You've also mentioned in others, you're worried about people that have been more at risk of this disease, including communities of color, also at getting low vaccination rates compared to white suburban residents. So what can you do, Governor, to make sure equity is first and foremost?
Well, as you know, we're working that really hard. First of all, you're right. We prioritize the healthcare workers in nursing homes and hospitals. Those were overwhelmingly nurses, often women of color. We got them prioritized number one. Not everybody wanted to get vaccinated, but we've gone back a second time, and especially in the nursing homes, the number of nurses willing to get vaccinated has gone up quite a bit. Our next group, you're right, was 75 and over. Obviously, the group that's 8 times more likely to suffer fatalities than other demographics. Also, really important what that means in terms of occupancy in our hospitals. Next will be 65. But at the same time, Lucy, we got our mobile vans. We're going to those underserved communities, often, people of color, going to churches, going to elderly housing, going to congregate settings, going to prisons, and doing everything we can to make sure these folks who maybe are a little less likely to sign up online with their iPad, make sure they don't get left behind, because they're a group that's most likely to suffer complications.
But when I mentioned there are instances where people that don't fit this criteria, we know there is a supply issue in this country that are getting vaccinated. What can you and the Department of Public Health do to make sure that doesn't happen again?
Look, you're right. Some people play games. Some people inadvertently vaccinate not just the school nurses, but some of the people in the school. Right now, I think you asking these questions, the community outreach, they know if there's a sense that the vaccinations are not fundamentally fair and that the right people aren't getting vaccinated first, and there's some sense of special favor, that undercuts what we're all trying to do. You're asking, what do I do? Do I arrest them, or do I sanction them, or do I fine them? Right now, we shout about and say stop. And, Bridgeport, there's been a little confusion there. We're bringing a few folks from our Department of Public Health down just to help them regularize the vaccination process there.
You mentioned Bridgeport. They're without a health director. That's problematic in a pandemic. You mentioned earlier that the state is doing well compared to other states in terms of the vaccination rate of its population, but also across the country, again, disparities reaching people of color across our country, including even in our state. And so you mentioned these mobile vans, but does the message have to change to reach, again, communities that are more at risk, who have comorbidities, Governor?
Oh, yeah. I need advocates in the community telling people every day it's safe. If you care about not just your health, but your family and your community, get vaccinated. Don't fuss about Moderna versus Pfizer versus J&J. They all save lives. And so when it comes to some of the underserved communities, we're trying to get really strong advocates. In New Haven, they got the Board of Alders calling up folks, telling them it's really important. I'm meeting with ministers and trying to get them to tell their congregations, just like they did 6 months ago when it came to testing. And some of the urban populations were a little reluctant about getting tested. We took the testing van right to the church. We rented the parking lot. And right after the service, people came out of the church or the houses of worship, and you could get tested. We're going to do that with vaccinations as well.
You're hearing Governor Ned Lamont here on Where We Live. If you have a question for the governor, you can join us, 888-720-9677. That's 888-720-WNPR, or find us on Facebook and Twitter at Where We Live. Is age the right criteria moving forward, Governor? Again, when we think about people who may be 75 and older, at a population that is at high risk, but they may live with people in their homes who aren't 75, and so they're not able to get the vaccine. Again, comorbidities being an issue among certain populations. Is there a better way to come up with these groups moving forward as the vaccination plan continues?
Well, obviously, 75 and over, much more likely. 65 and over, much more likely. 65 and over, if you're black and brown, you probably have the same complication or fatality rates as a white person. 75 and over. Your question, sort of, Lucy, is how long do you go down that age scale? It's certainly a lot cleaner to implement rather than saying, are you a nurse or a daycare person, or do you have, one or two comorbidities? But so at the same time we're doing based on age, we're definitely going out to the most vulnerable communities and making sure that nobody's left behind.
Kathy tweeted she wants to know, will the state partner with CVS and Walgreens to bring the vaccines to state-run facilities? So that's DMS, DDS, the Department of Correction, and other congregate settings like group homes, the way that the state did for nursing homes and assisted living facilities, Governor?
Yeah, Kathy, we will. As you know, CVS and Walgreens are already opening up their first of their retail outlets. Little back and forth. We'd like some of those retail outlets to be in some more urban communities where, a lot of vulnerable people are. But to your bigger question about the congregate settings, elderly housing, mental health, addiction, those are priorities for us. And either it's going to be CVS or we're going to be doing this ourselves or working with Hartford Health and the other hospital providers to get those mobile vans to those communities.
Again, you can join our conversation with the governor, 888-720-9677. Before I take a caller, Governor, we know that people, especially if they have loved ones who are teachers, they want to see teachers in our state be a higher priority with the vaccine. Is that something that you're considering?
Well, certainly they're in the next group. A little more likely to be white, by the way, Lucy, than some of the other categories we're talking about. But look, we're prioritizing teachers as well. But I'm not going to beat around the bush. I mean, we've got, well over 1 million people in this next group as defined, 1B by the CDC. So not everybody can be a priority, but believe me, those teachers who are showing up in the classroom every day, making a difference for those kids, I'm going to do everything I can to make sure they get vaccinated early. And by the way, we've already prioritized teachers for testing. We have bluntly a lot more testing capacity so that we have special times and places for teachers to get tested.
You mentioned they're in the next group. So what does that mean, Governor? So we're in February. Could teachers get vaccinated starting in March or April? Many people worried about these variants that are more contagious, and they're worried about that, Governor.
I think we're going to go, Lucy, 75 and above, 65 and above. And then we're working with our friends down in Washington, see what guidance they've got, what we do in terms of next categories, but really focusing on underserved populations and some essential workers. I'll be blunt. I mean, are daycare people essential workers? How about frontline manufacturing and defense industries? Are they essential workers? How about restaurant workers? They show up every day and interfacing with people. So there are a lot of groups that can make a case that they're essential workers, and that's the balance I'm trying to reach.
But you have also under our Commissioner Cardona, who may again be moving very quickly to U.S. Secretary of Education, depending on his confirmation hearing. You've been very strong about keeping schools open, and so wouldn't that give teachers and other staff peace of mind that they're in these buildings, some very old, not great ventilation, with a lot of bodies, that they can be protected, Governor?
The answer to that is yes. It's the same answer for a lot of the other essential workers defined by the CDC. But believe me, I understand. I'm doing everything I can to give teachers the confidence that they can get back to school. Miguel Cardona is hearing today. Tune in, cheer him on. He's going to be an amazing Secretary of Education. He believed strongly in getting our kids back into the classroom, at least the option to go into the classroom, really prioritize public health and public safety in the classrooms. And thankfully, Connecticut, compared to at least all the other states in the Northeast and beyond, we have more of our kids with the option to go into the classroom than just about anybody.
We're going to take some calls. You can join us 888-720-9677 as we talk with Connecticut Governor Ned Lamont. Dee's calling in from Clinton. Dee, go ahead. Dee, can you hear me?
Yes, I'm just wondering about prioritizing teachers. I'm an older teacher, and I work in a building that's older with ventilation issues, and I'm wondering about teachers being prioritized, especially older teachers, as soon as possible for the vaccine.
Yeah, Dee. Well, as we said before, certainly older teachers because they're in the 65 and above category, although maybe they're not that many of them. And Lucy and I were just talking about, teachers in general, especially the teachers who are actually in the classroom every day, doing what we can to give them a priority.
Again, you can join us 888-720-9677. Pat's calling in from Newington. Pat, what's your question for Governor Lamont?
My question is, under your executive orders, you have extended the immunity for nursing homes and assisted living facilities. Because these facilities were the first people to have their workers and residents vaccinated, why are we continuing to extend this civil immunity? They should be held responsible for negligence, especially during this time.
Governor?
Yeah, Pat, I think that's a really good question. I mean, first of all, we gave them immunity in the hospitals back during the height of the pandemic. It was we were bringing a lot of retired nurses back. We were trying out new therapies. You could sort of understand why I didn't want to do anything that made nursing homes or hospitals hesitant about taking care of people in need. And you can say, all right, that's then, now's now. People have been vaccinated in their nursing homes. Let's hold them accountable. And frankly, I'll be blunt, it's something we're looking at. Remember, as Lucy pointed out, there are a variety of new variants that are out there that may give people some hesitancy about, going into work. But more importantly, we are holding people accountable. I believe in that. We shut down one nursing home that was not getting the job done. We've sanctioned other nursing homes. We're inspecting them all the more often. GARD is going in there, making sure that the antiseptic rules are being followed carefully. So you hold people accountable by lawsuits, and you also hold them accountable by regulation.
Governor, with your emergency authorization extended through April 20th, right now that civil immunity for nursing homes has also been extended. But when we talk about giving people a chance, especially if their loved ones are in one of these facilities and they worry about negligence and substandard care, I'm just wondering, why continue this? You've been asked this question before, and it's been extended. And so, what will be the point where you feel like that people should be able to have the freedom to file these lawsuits if they're worried about the care their loved ones are receiving?
Well, Lucy, the most important thing is with getting everybody vaccinated in nursing homes and you getting tested, it's easier for you to come into the nursing home and see your loved one. Remember, that was not something we were allowing some time ago. And we lost a lot of accountability, I think, in the nursing homes when you didn't have a daughter or a son who's able to speak up for you. Again, we hold people accountable by regulation. We're pretty strict about that. And the question is, when do we allow lawsuits there? And it's something I'm looking at, and we'll make up our mind very soon.
Mm-hmm. Right now, is it the Department of Public Health that would investigate claims of substandard care, Governor?
Yeah, they are investigating, and they are coming down with fines and like I said, shut down one nursing home.
Again, you can join us 888-720-9677 as we talk with Governor Ned Lamont. Josh is calling in from West Hartford. Josh, go ahead.
Hi, Governor Lamont. Thank you very much for all you've been doing. I just had a quick point I wanted to advocate. I know that you mentioned teachers and my family member is a special education teacher. She's going in every day, kids in person. And a lot of these kiddos cannot wear masks because of, behaviors and stuff. So she's at an increased risk, has no, vaccine in sight and words from her union. And it's just seems like we're getting the runaround. And then, there's speech and occupational therapy and stuff in the classroom who are being vaccinated. And I think something needs to be mentioned for special education teachers who are at a heightened risk. So if there's anything you could do, we'd greatly appreciate it.
No, Josh, thank you. Look, special education teachers, social workers dealing with folks with intellectual disabilities, physical disabilities, not able always to wear the mask. There are a lot of groups that ought to be priorities. And let's face it, the number one problem we've got is we don't have enough vaccines. Connecticut is well positioned to deliver 5 times as many vaccines, and there are a lot of essential workers out there to deserve it. I can tell you, I'm talking to the CEO of Pfizer today. I'm saying it's great. We're getting a 10% increase in vaccines over the last week from the feds, and that's kind of helpful. It's great that you're getting another 10,000 vaccines to our retail facilities. That's great. When are we going to multiply that by a factor of 2 or 3? And what can we at the state or federal level do to help move that along?
Stephen's calling in from New Hartford. Stephen, what's your question?
Yes, my question is budget related. Many towns in Connecticut are reliant on funding flowing from the state to the towns, and I'm wondering what it's going to look like in the upcoming budget. Are the towns going to be facing layoffs with their own employees and with library staff that rely on those same budget numbers because of the pandemic?
Yeah, Stephen, excellent question. I give this the speech next week. Here's the deal. First of all, like we did in our first budget, we hold all of our towns and municipalities harmless so they know what they can count on and they can plan accordingly. Now, given the nature of the pandemic, we've got tens of millions of additional dollars, many of which are thanks to the feds, by the way, going to our municipalities. A lot of that is going to education. So we do everything we can to make sure our schools stay open, they stay open safely. We're trying to help out our municipalities a number of different ways. We've done a lot for small business. We've done a lot for overtime, doing what we can at the state level. And sort of the way, Stephen, it was with small business and the PPP program, if you remember that, Paycheck Protection. I can't bail out everybody, but we provided a bridge to the federal support. And I'd like to think you're going to see federal support over the next month or two. And you're going to find in our budget, we're doing everything we can to keep our towns as well as municipalities whole. And that goes for our not-for-profits as well. They're working overtime. They're taking care of people in need. And we're getting them the additional resources they need.
Governor, what can you tell us about your budget address next Wednesday? Will you be introducing some new revenue sources for the state? What would they be?
When it comes to the revenue sources, first and foremost, I still, Lucy, have a transportation fund that's going bankrupt. Nobody likes me to really bring that up, but as you can imagine, people are driving less and the low price of gasoline and Teslas. There are a lot of reasons that we're going to have to find a way to fund our transportation system. So I've got, two proposals there. One is called the Transportation Climate Initiative. It's not going to be very popular. It's a tough choice, but I'm doing it with my regional governors, something I like to do. And that's money that's going to go to, environment and transportation. And we've got a couple of other ideas there. In the general fund, I'm not looking to raise tax rates, something the 5 previous governors have done in their first term. I think it was their first term. But I think we're going to be probably, for example, looking at new sources of revenue, marijuana, online gaming, and I think that's going to bolster our situation. And finally, it's worth remembering we do have a big rainy day fund. So to make sure that I don't have to cut social services during a pandemic, that gives us protection. And we'll see what the feds do.
The gap between the wealthy in this country and middle and low income residents continues to grow, especially in our state. What was your reaction to Senate President Martin Looney's statewide property tax proposal, as well as Representative Scanlon proposing a tax credit for middle class and low income families, Governor?
Well, the tax credit, I think, is something you're going to see coming out of the federal bill. I'd like to think they're still going to have, in particular, the earned income tax credit, which will be enormous. And look, I was a Joe Biden supporter from the beginning. I understand the inequities in our society. It's going to be front and center in my budget. When it comes to raising taxes, some of which you've just brought up, I think for a lot of that, I'm really going to rely upon the federal government to take the lead there. And let me tell you why. I mean, right now, I can raise taxes, and I'm already 40% more than Massachusetts and 20% more than Rhode Island and infinite more than places like Florida and Texas, where thousands of people are going. And one of the reasons, Lucy, we've done pretty well in this last economic cycle is because we had people saying Connecticut's getting its fiscal house in order. Tens of thousands of families have moved into the state of Connecticut. And a lot of them were paying capital gains tax, and a lot of them helped our budget go into balance for this current fiscal year.
So when I asked you about the statewide property tax, this is not a proposal that you would support. You think that if this were to pass, people would leave our state, Governor?
I think a whole new type of tax at this point in the middle of a pandemic, a tax on houses as low as $430,000, which are middle-class houses. No, I don't think it's the right way to go.
And as far as the tax credit, you want to see that coming from the federal government, not from the state of Connecticut, for middle and low-income families.
Let's see what the federal government does, Lucy. They're still getting their act together, but I think you're going to see a significant relief in the next bill. We have significant relief in the last bill, $900 billion that they did in December, but that's primarily oriented towards small businesses, the smallest businesses, and education and unemployment.
Last week, I believe, if I'm getting my days straight, you proposed universal access for broadband for our state by 2022. Former Consumer Counsel Ellen Swanson-Katz was a big advocate for equitable broadband access. She left the job in July of 2019. There's been an acting Consumer Counsel, I believe, for more than 18 months. Why haven't you nominated a permanent Consumer Counsel, Governor?
Well, first of all, on the broadband thing, Lucy, if we've learned anything, equal access or equitable access to broadband is not a nice to have. It doesn't allow you to download music and shop on Amazon. It is absolutely vital when it comes to education, when it comes to telehealth, and increasingly telecommuting and how you're able to work. The last 2 days, people were working from home because of a snowstorm. I can't let those people stay behind. I got a great group at PURA, which is the regulatory board that's doing everything it can to expand broadband around the state. We'll be talking about that. The Consumer Council, Paul's got somebody in mind, really good. They just have to disentangle, I think, from what they're doing right now, so it's going to take a little bit longer.
We know that you have to go to a vaccination clinic in Waterbury, Governor, but I have to ask in terms of environment. There are people that have been protesting against plans for a natural gas power plant in Killingly. The Connecticut Mirror reported you told environmentalists you don't want it, but the permits seem to be moving along. The developer hasn't given any indication the market conditions are unfavorable. If you don't want to see this power plant, what can you do to stop it, Governor?
Well, first of all, I'm really proud that Connecticut's a leader in the country in having what will probably be the first zero carbon electric grid. And that is going to be 90% carbon free within just a few years, Katie Dykes tells me. And I described the next largest source, or now the largest source of pollutants in our state is our transportation system, and we're making progress there. Look, the Killingly plant, it's a natural gas plant, obviously twice as efficient, 3 times as efficient as the other plants, the older plants here in the state. Do I want to build one of the last natural gas power plants in the state of Connecticut? No. Are there a lot of games you can play that could potentially slow it down? No. I mean, right now there's a group called ISO. It's a regional group. They have authority over this. We're going to regulate the heck out of it, keep a close eye on it. I don't necessarily want to see it built. I'm not quite sure how many legal roadblocks you can put in the way.
You mentioned ISO New England, but haven't they said that, it's each New England state controls what is built in their state, Governor? And so passing the buck to them completely, it's also something that you and DEEP can also work on, especially if you don't want to see it happen, as well as residents in our state.
No, that's not right. ISO is the regional body. Everybody is signed on to it. I didn't sign on to it. I want to deregulate ISO. They don't take into account carbon in a way that they should, and they force some things like Killingly on us. We have some local regulatory in terms of water courses and things. We do, but we're going to follow this very closely, Lucy.
We'll have to leave it there because Governor Lamont has to head over to Waterbury. We appreciate your time, Governor. Still a lot of listeners want to ask you questions. We hope you come back soon.
Thanks, Lucy. Thanks, everybody. Be safe.
This is Where We Live on Connecticut Public Radio. I'm Lucy Nalpathanchel. Coming up, we're going to hear from Mark Pazniokas, Capitol Bureau Chief for the Connecticut Mirror. We heard a little bit about the budget proposal that he'll release, the governor, next week. And also we'll get some more context about the relationship between the governor and the legislature. You can join us too. Find us on Facebook and Twitter at Where We Live. This is Where We Live on Connecticut Public Radio. I'm Lucy Nalpathanchel. You just heard Connecticut Governor Ned Lamont, who has extended his emergency powers to middle of April. Not everyone agrees with that decision, including Republican members in the Connecticut General Assembly. And next week, the governor will also release his proposal for the next 2-year state budget. For more context on what's happening in our state government, joining us now on Zoom, Mark Pazniokas, Capitol Bureau Chief for the Connecticut Mirror. Mark, welcome back to the show.
Thanks for having me.
So I wanted you to respond to what you heard from Governor Lamont, especially when we talk about vaccinations. Again, the equity issue, a problem not only in our state, but nationwide. I'm just curious what your thoughts were on what he was saying about outreach and if the state has been doing enough to get there.
So what you heard is really a consistent message that the governor has put forward. They have chosen so far, I think, simplicity over more complicated approaches. And I don't say that to dismiss it. The governor, as he said to you earlier, and as he said in the past, it's pretty simple to say, okay, 75 and older. That's a very clear line. It's an easy standard. And then you're going to go to 65. And then, as he noted, in the next group after that, there's 1 million people, and trying to set priorities within that group is something they have been wary about doing. You had some pretty, kind of heartbreaking calls. I mean, the gentleman who called about a family member who's a special ed teacher, he made a great case, right? These special ed kids cannot be wearing masks. These teachers are at greater risk. And that's the kind of stuff that the administration, I think, is going to have to do. The details as they go forward with this are going to become more difficult and arguably more important. The Mirror has done a story about racial disparities, and it's just sort of the demographics. In the older group, 75 and above, that tends to be white folks. When you get to 65, there's a lot more people of color, and including there's some data that indicates that people of color 65 or older are actually at greater risk. So there is some balance then. But then you get to the questions of outreach, and it's not just about making it available, but it's also about the messaging and trying to have confidence in some of the urban communities where there's a lot of doubts about medical institutions. There's a lot of history there. And we've seen that in the nursing homes where some of them, the utilization rate was in the 40%, even though the vaccine was available for 100% of their employees.
Now, the Department of Public Health is helping municipalities. They're running this vaccination program around the state. Have there been any issues that, will interfere with the work that needs to be done? The governor mentioning Bridgeport needing help, and they don't even have a health director down there. But I'm wondering if you can give us some context on, we have a acting commissioner, Deidre Gifford, who's running both the DPH, but she's also a DSS commissioner. There have been issues with staffing and communications of that department. And because the governor said to us, it's only going to get more complicated, should we have full faith that this is going to work out to the best? We don't know in terms of supply and demand, of course.
Well, so the Bridgeport case raises an important thing that your listeners need to understand, that Connecticut does rely to a very large degree on local public health officials. It is one of the few areas in Connecticut where there's some decent level of regionalization, and instead of having 169 public health directors, it's somewhere between 50 and 60. So there is some smart regional approaches. But this was clear early on when it came to the tracing and tracking, that it's really done more at the local level. And Connecticut has underfunded these local public health officials for years. That became clear early on. There's a formula that has to do with, per capita rates, and they have underfunded that. And that's something that, is been exposed, that there's that weakness there. So you're going to see disparities. You're going to see differences, I think, in the different cities and towns based on the quality and the aggressiveness of the locals. The Mirror has done a story where you looked at, in Vernon, they're doing some creative things with Uber. In the Bloomfield, West Hartford district, there's a plan to use firefighters to go door to door once they identify vulnerable people who perhaps do not have the ability to get out and get to a vaccination center, that they're going to actually have paramedics accompanied by nurses, going out there. And that's what you're going to need to make this thing a success. At the state level, I don't know that the acting status of Deirdre Gifford is an issue. There's certainly been some management issues at DPH before Gifford got there, and there was certainly the controversy over, the amount of the contract to hire a communication firm to help out. I think there's a quiet admission in the administration that $250,000 for that was excessive.
Well, I asked the governor about the extending, a caller also wanted to know about the extending the civil immunity for nursing homes. This is something that will continue through April 20th. Why does the governor favor this? This has become again, continuing to continue this immunity for months now. Did you feel like his answer to that question was satisfactory?
Well, it's the answer he's given for a while, and there's no follow-up on his part. He says it's something they're looking at, and then nothing happens. So I really can't give you any more insight than that. He's given that answer several times. He's indicated it's under review. He is suggested it's going to change, but then it doesn't. So I can't tell you why or when you'll see something.
It's interesting to note that, we think about the regional approach to this pandemic. New York State has lifted that civil immunity in relation to nursing homes. So it is curious that the governor continues to have this here in our state when we're hearing from families and advocates that it's not something that's necessary at this point. So we'll have to stay tuned on what happens with that. And, before we head to break, I want to hear more about the story that you did with about the governor's relationship with the legislature as we get his 2-year budget announced next week. But I'm wondering if you could just tell us some broad strokes. Today is a big day for Dr. Cardona, who is Biden's choice for education secretary. How will he be remembered? Again, not everyone agrees with this push in our state to keep schools open.
Well, it's been the great balance, particularly at the younger grades, and in communities where maybe there's a single parent or people the parent is working. This has really been a lost time, I think, for a lot of younger children in urban schools, and Miguel Cardona feels that deeply. He grew up in public housing in Meriden, and I think he is extremely sensitive to really the losses that these children are facing in kind of very vulnerable time. And so, yes, he's pushed back on that. It's understandable why teacher unions are saying, hey, if you're going to push us to be in the classroom, then maybe you should raise our priority on the vaccinations. These are all reasonable complaints and reasonable suggestions. And of course, as the governor said, if you prioritize everybody, you prioritize nobody. But this is something that Cardona was firm on from day one. On the other hand, the governor did not make it a requirement. The state. They punted to the school superintendents. It certainly fits in with the culture of New England, where there's local control of the schools. But the state could have taken the heat, and the state could have mandated that, particularly at elementary school, that you go back to in-classroom instruction. And perhaps if they had done that, there would have been a responsibility for the state to then elevate those teachers for vaccinations. But that's something Cardona, again, has been consistent on since the pandemic arrived.
Again, you're hearing Mark Pazniokas, Capitol Bureau Chief for the Connecticut Mirror. After a short break, we're going to hear more about the governor's learning curve dealing with the Connecticut General Assembly. This is Where We Live. This is Where We Live on Connecticut Public Radio. I'm Lucy Nalpathanchel, broadcasting remotely. With me on Zoom, Mark Pazniokas, Capitol Bureau Chief for the Connecticut Mirror. We heard from Connecticut Governor Ned Lamont in the first part of the show. Again, the governor is running the state during a pandemic, but he also has to submit a new 2-year state budget. Governor, talk about the governor. So, Mark, can you talk about the relationship that Ned Lamont has with the legislature and some of the learning curve that he's had in this third year of being our state leader?
It's striking that the governor and legislators still are trying to figure the other party out. The governor is, people run for office touting themselves as outsiders. That's become something of political value. But in the case of Ned Lamont, that is real. He has been around politics for certainly quite a while. He was on the Board of Selectmen and the Board of Finance in Greenwich a long time ago. He ran for U.S. Senate. He ran for governor in 2010 before winning in 2018. But culturally, he really is an outsider in Hartford. Geographically, culturally, politically, he does not get the rhythms of the General Assembly, what it's like to pull together a majority in a 151-member House or 36-member Senate. I mean, that's been clear from day one. His approach is to reach for consensus, which of course, I think most people would applaud to a degree. His line was, my door is always open and I have a big table. Come in, sit down and give me your ideas. And that is great to a point. But the reality is when you are trying to pass anything that is controversial or has a political risk, that requires drawing some sharp lines eventually. And that's been one of the complaints about Ned Lamont's management style. He said in a conversation with me recently and with the rest of some folks at the Mirror that he's going to change that. He's going to be more definitive this time. He has a couple of items on his agenda that are going to be controversial. The expansion of gambling in Connecticut, that of course requires cutting a deal with the tribes who have exclusive rights to casino gaming, and they believe that also extends to sports betting. And then you have the question of legalizing marijuana, and that's going to require a governor to clearly say how he thinks that should work, because the sale of marijuana, as a concept, it's a simple thing. You're either in favor of it or you're not. But then you get down to the nitty gritty, and there's a lot of complexities there. There are issues of equity in the licensing. Who can grow and sell this stuff? Where should the money go? Should this be an opportunity to kind of redress some of the criminal justice inequities about who tended to be arrested for marijuana possession before it was decriminalized in Connecticut? And those are the things that really requires a governor and an administration to have an idea of where it wants to go, and when you should give and compromise and when you should draw a hard line. And we have really not seen that much from Ned Lamont. He had a first year test with tolls, which really was a disaster in that the way he presented it, he had reversed himself on a campaign promise. He campaigned on really being open only to tolling on trucks. And then in his first full month as governor in 2019, he proposed highway tolling on all motor vehicles. And he really did not do a good job of selling it. He did not explain why this was needed in any really detail. Eventually, they put out a pretty good plan that showed why this money was necessary and what it would mean for your average Connecticut taxpayer. They put it in terms of reducing commuting times in very specific sections of I-95 and 91 and 84. And that was all good, but it took them 8 or 9 months to do that. And then again, they went back to truck tolls when it was clear that cars weren't going to pass. So, that was his first year experience. And if you look at this as almost a 3-act play, Act 1 was tolls. And, the governor likes to talk about other things, that he had a budget that was delivered on time. There was no broad-based new taxes. The state did get some positive attention from the Wall Street Journal and others about, a greater degree of fiscal stability, although, Lord knows that the state still has significant challenges ahead fiscally. And then you had, Act 2. Everything changed. The pandemic arrived, the legislature left, and lo and behold, the governor, who was one of the least popular governors in the United States, suddenly did not have a legislature to deal with. And his management of the pandemic, generally speaking, has been well received. The polling has been consistent. People disagree with details here and there. And you heard that in some of the calls today, even people who were complaining about a specific thing. Some of them, seem to be generally disposed to how he's handling it, because I think the pandemic has allowed the governor to show what was one of his strengths. He is genuinely, I think, an empathetic person. He does come across in his COVID briefings as somebody reasonable. He is not somebody who lectures the way that Governor Cuomo does in his briefings, and Cuomo.
And he's certainly not a Dan Malloy.
He is not a Dan Malloy. He is, and there's good and bad to that. There are legislators who, felt brutalized at times by Dan Malloy, but on the other hand, they admired the fact that Malloy almost always knew what he wanted and was willing to push. His first 2 years as governor, even though he was elected, by a paper-thin majority, and by those lights, he really had no political capital to spend. But he really dominated, and he has made a difference. He made a difference on criminal justice reform, on prison reform. They did some things with concessions with employees. Conservatives certainly would say it wasn't enough. But if you look at the political realities of the 2 concession deals he did make some changes. Connecticut's pension is still woefully underfunded, but the pension fund now going forward for people who are now hired today, that is adequately funded. It's really the historic mistakes that Connecticut made over decades in not in offering too much in benefits and not putting enough money away. So there's that great contrast with Dan Malloy, and I hear that in my conversations with legislators, that they do miss dealing with Malloy, who they knew where they stood. If Dan Malloy was asked a question about immunity on nursing homes, in all likelihood, if he gave you an answer that we're doing something there, that within a week you would have probably seen something.
We'll have to leave it there. That's Mark Pazniokas, Capitol Bureau Chief for the Connecticut Mirror. Again, the governor will have a budget proposal out next Wednesday. We'll be talking about that next week. I'm Lucy Nalpathanchel. Today's show produced by Matt Dwyer.